Today we're going to be talking about congestive heart failure. A couple of things we got to know before we begin our study of congestive heart failure. Number one, the goal of the cardiovascular system is to maintain blood flow. So basically what that means is that whatever the body is demanding in terms of blood flow, the cardiovascular system has to produce it. On average, with normal heart function at rest, the heart pumps about 5 liters of blood each minute, or 5,000 cc's per minute. And again, we don't pump all 5,000 cc's at once, otherwise you'd have the left ventricle the size of a Buick hanging out of your chest. Instead, what we do is we pump a little bit of blood, so your stroke volume, or the amount of blood ejected with each beat, times the number of times your heart beats, or your heart rate. So simply put, cardiac output is equal to how many times your heart beats per minute times the amount of blood ejected with each beat of the heart. So if you want to increase your cardiac output, you can increase your heart rate, or you can increase your stroke volume, or both in normal heart function. But we're going to be talking about congestive heart failure today. So before I begin, there's a couple of things that you absolutely, positively have to know. Number one, there is no pressure in the venous system. Please write this down, tattoo it someplace. The other thing you need to know, systemic veins, all the veins dump blood into the right atrium. Here's the problem. If there's no pressure in the veins, then how does venous blood get back to your heart? The answer is 2 ways. The largest veins of the body are deep inside muscle, specifically your leg muscles, and they store a lot of extravenous blood. So when you get up and you walk around, you will contract your muscles, and by contracting your muscles, you're going to squish those veins, and when you squish those veins, that increases the venous blood back to the heart. Now if you look, when the muscle relaxes, the valves that are in these veins close, so that it prevents that backflow pressure of blood in the vein. So if you look at a person who's on their feet all the time, or an older person, they got those natty, rotty, nasty looking varicose veins, that's simply the valves in their veins being stretched out. The biggest way blood gets back to your heart is through the contraction and relaxation of skeletal muscle, because there's no pressure in your veins. The other way is the fact that the heart is in your chest, and you got your 2 lungs right here. And when you breathe in and out, it creates like a booger squeezer effect, and it will suck that venous blood back to the right side of your heart. The other final way that you get blood back to your heart is simply through gravity. Now look, most of us are upright during the day, so we store a bunch of venous blood in our legs. When you lay down, all of that venous blood by gravity is going to come back to the right side of the heart. These things are critical when you understand congestive heart failure and exactly how it works. So real quick, there's no pressure in the veins, and there's basically 3 ways that venous blood can get back to your heart. Contraction and relaxation of skeletal muscles, pushing the blood back to it. The booger squeezer effect of sucking venous blood back to your heart, or gravity. That brings us to the next big point. Remember that all veins of the body dump their venous blood into the right side of the heart. So if we look here comes all the venous blood back to the right side of the heart. When that venous blood enters the right side of the heart, it has to go to the lungs to get oxygenated. One of the things I'd like to point out, when the right side of the heart contracts, it's going to send it through the pulmonary vessels, and those pulmonary vessels get smaller and smaller as they go deeper and deeper into the lungs, until they terminate at the level of the pulmonary capillary and the alveoli, and that's where gas exchange occurs. So you take some oxygen from the alveoli and you push out that carbon dioxide into the alveoli and you exhale it. This blood that's newly oxygenated is now going to come back to the left side of the heart through the pulmonary veins, and then it's going to get sent out to the body. Okay, again, a critical piece here, absolutely critical for you to understand congestive heart failure. The right side of the heart and the left side of the heart pump exactly the same amount of blood. That's the definition of congestive heart failure. When one side of the heart can't pump the same amount of blood as the other. So in the most common part of the heart that fails is the left side of the heart. The left side of the heart has to pump exactly the same amount of blood as the right side. This is the key. Where did the right side of the heart get its blood from? The answer is it got it from the blood of the veins in the body. So what ultimately determines the amount of blood pumped by the right heart is the amount of venous blood that's returned to it. The term to describe the amount of venous blood returning to the right side of the heart is called preload. Preload is the amount of venous blood that's returned to the right side of the heart. So let's look. If the amount of blood pumped by the right side of the heart is determined by the amount of venous blood returned to it, and the right side of the heart and the left side of the heart pump the same amount of blood, what ultimately determines the amount of blood pumped by the left side of the heart is the amount of venous blood that's returned to the right. So, really important, critical, can't even tell you how important this is. Anything that affects venous return of blood to the right side of the heart is going to affect how much blood is pumped by the left. So an example, if you're bleeding, your blood volume is going to drop, and that's going to decrease the amount of venous blood back to the right side. The right side's now got less blood. It's going to pump less blood to the lungs, and all that blood comes back to the left side. And if the right side is pumping less blood, that means the left side's pumping less blood. And when the left side sends out that oxygenated blood, it's going to send less blood to the brain and body. So, in summary, the amount of blood pumped by the right heart is equal to the amount of blood pumped by the left. And the amount of blood pumped by the right heart is determined by venous return of blood to the right side of the heart. A couple of other things. In clinical, there's a couple of terms that you have to understand to appreciate congestive heart failure. Those terms are ejection fraction, end diastolic, and end systolic volume. So I'm going to break this down for you. First of all, the right and left side of the heart contract at the same time. They also pump the same amount of blood. Now here's the kicker. The amount of blood that's in the ventricles before it contracts is called the end diastolic volume. And in a normal heart, it's about 110 cc's. When the ventricles contract, they don't push out all that blood to the lungs or to the body. There's still some blood left over. So the amount of blood left in the ventricles after it contracts is called end systolic volume, about 40 cc's. The normal stroke volume, or the amount of blood ejected with each beat of the heart, is about 70 cc's. So each time the ventricles contract, they're pushing out about 70 cc's of blood. So if cardiologists want to look at how well this heart is contracting, they look at the stroke volume, and the normal stroke volume should be about 70 cc's. And then they look at the end diastolic volume. And the normal end diastolic volume, or the amount of blood in the ventricle before it contracts, is about 110 cc's. So then what they do is they look at the efficiency of the ventricular contraction. They look at what's called the ejection fraction. And the ejection fraction looks at how well the heart's contracting. So they take the stroke volume and divide it by the end diastolic volume. And if you look at these numbers, 70 divided by 110, that comes out to about 65%. So in a normal heart, the ejection fraction should be about 60 to 65%. That means the heart's functioning normal. All right. Well, in congestive heart failure, and in particular left-sided heart failure, and we're talking about the left ventricle, the problem is that left ventricle doesn't contract so well. Okay. So what we're now going to do is we're going to talk about pathophysiology of the congestive heart failure. Again, both sides of the heart pump the same amount of blood. They do so under different pressures. The left side of the heart, 120/80 systolic diastolic. The right side of the heart, 25/15 systolic and diastolic. So again, even though they pump the same amount of blood, they do so under very different pressures. So because the left side of the heart works harder, the left side of the heart, and specifically the left ventricle, is the one that you usually have problems with. The most common cause of congestive heart failure is myocardial infarct. So watch. This part of the heart is dead. What does dead tissue do? Nothing. it's dead. If you're a CNA at a nursing home, a couple of the nursing assistants call in sick, you still have to get the same amount of work done. So the remaining CNAs have to work harder. So if your heart is damaged by a heart attack, the remaining muscle of the left ventricle has to work harder. This is important. It's critical. And the remaining good parts of the left ventricle do so by stretching. So the remaining healthy parts of the ventricle will stretch to try to contract that heart better. And essentially what happens, the left ventricle becomes stretched out and dilated. The result is that even though the remaining healthy parts of the left ventricle are trying to help out, they can't make up for that dead part. So let's be honest. You're working as a CNA, a couple of CNAs calling sick. Are you going to be doing the same kind of job you did before if they were there? The answer is no. So even though the remaining healthy parts of the heart are stretched, they still don't contract as well. So there's a decrease in the force of contraction of the heart. This is how it works. So even though the heart's contracting weaker, because it's dilated, it's stretched out, there's more blood in it before it contracts. So the amount of blood in this dilated left ventricle is going to go up. So that means that your end diastolic volume is going to increase. Why did it go up? Because you had a dead part of your heart and the remaining parts of your ventricle have to stretch. So the chamber size gets bigger. Here's the other thing that's really important. You still have to pump out that 70 cc's per minute. So you still got to pump that out. So when the left ventricle, even though it's contracting weaker, it still tries to pump out that 70 cc's of blood. But now, if you look at how efficiently this damaged, dilated left ventricle is working, you take the ejection fraction, your stroke volume, divided by your end diastolic volume. So in this case, it's 70 cc's. What's the end diastolic volume in a stretched out left ventricle? 210. And that comes out to about 33%. Less than 45% is consistent with congestive heart failure. As the ejection fraction drops, that means the heart failure, it's getting worse. People with ejection fractions of 15% are waiting for heart transplants. So that heart is really struggling to get that blood pumped out. So, as a nurse, what do you want to do if your left ventricle not contracting so good? So here, we have a normal left ventricle, thick muscular wall, right? You got blood in there, and you got 110 cc's. How much blood you got to pump out with each beat? Well, let Timmy tell you. 70. So that's where you get your ejection fraction in a normal heart, about 60-65%. Here, you got a damaged left ventricle. You had a heart attack. What does the rest of the ventricle got to do? It's got to stretch, try to compensate for that. So now, you got this big old ventricle that ain't contracting so good, and now it's got a bunch of blood in there. And what is that? That's 210 cc's. But you still got to pump out that 70 cc's of blood. That's how the ejection fraction drops in people with congestive heart failure. If you understand these little basic concepts, you will understand why they do what they do for people with congestive heart failure. If you don't understand these things, then you will be left, like I was, to try to remember, to put a person's head up, to watch their intake and output. Now, because I learned this stuff, I don't have to remember it and know it. And that's my goal for you. Now watch. What determines the amount of blood pumped by the right heart? The amount of venous blood returned to it. So when the venous blood comes back to the right side, gets pumped to the lungs, and that blood comes back to the left side. The left side in a person with congestive heart failure, that heart is maximally stretched out. It can't stretch anymore. So do you want to be adding a lot of extravenous blood back to your heart if your left ventricle is as stretched out as it's ever going to be? The answer is, of course, no. So what do you want to do with someone with congestive heart failure? Well, watch. Look, the left ventricle ain't contracting so good. And if it ain't contracting so good, you want it to contract better. So what do? You give them a medicine called digitalis, digoxin, vivicafoxin. Digoxin in heart cells, so if you look here, here's a heart cell in the muscle wall, and embedded in the cell membrane of that heart cell is a pump. It's called the sodium-potassium pump. What the pump does is it takes 3 sodiums that leaked into the heart cell and pumps it back into the blood, and 2 potassiums that leaked out of the heart cell and pump it back into the cell. And because that works against the concentration gradient, that requires energy. Here's the kicker. Here's the important piece. Here's your blood, your potassium. You take some digoxin binds at the same site as potassium does on the sodium-potassium pump. What that does, it inhibits that pump. The result is that sodium stays in the cell and potassium stays in the blood. But if sodium stays in that heart cell, water will follow it by osmosis, and the heart cell can swell. So you got to get rid of that sodium. So when your sodium-potassium pump is inhibited by digoxin, there's a little protein exchanger called the sodium-calcium exchanger. And when sodium starts building up, that sodium gets exchanged for calcium. Sodium goes into the blood, out of the heart cell. Calcium comes into the heart cell. And write this down, tattoo it, never forget it. The most important element in muscular contraction, without it, a muscle will not contract, is calcium. And the heart and blood vessels rely almost exclusively on calcium from the blood to contract. So how digitalis works is by binding to the potassium sites on the sodium-potassium pump, preventing the sodium-potassium pump from working. The result is, you got to get rid of that sodium. So the sodium is exchanged for calcium, and now you got more calcium in that heart cell, and that heart will contract harder. Anything that increases the force of contraction of a muscle is called a positive inotropic agent. That's a fancy way of saying it makes the heart muscle contract harder. And that's exactly what you want. In a person who's got a bad, jacked up left ventricle, you want to make that heart contract harder. What do? You give them digitalis, digoxin. Ultimately, what that's going to do is increase the amount of calcium inside that heart muscle cell, and that heart will contract harder. We just learned preload, or venous return to the right side of the heart, determines the amount of blood pumped by the right side of the heart. And the amount of blood pumped by the right side is equal to the amount of blood pumped by the left side. So, do you want, in a person with a jacked up left ventricle, a lot of venous blood coming back to the right side of the heart? The answer is absolutely not. And we know 55-60% of all blood is wawa. How do you get rid of extra water? You pee it out into the toilet. So, the other medication that's used to treat congestive heart failure is a medication that's going to reduce the amount of venous blood returning to the right side of the heart. And the medicines that are commonly used are diuretics. Diuretics make you diurese. They make you pee a lot. So watch. If you take a drug that makes you pee more than you should, and blood is 55 to 60% water, what's going to happen to your blood volume? Well, let Timmy tell you, your blood volume is going to go down. That means venous return to the heart is going to go down. And if there's less blood in the right side, that means less blood to the lungs and less blood in the left side. And in a damaged left ventricle, that's exactly what you want. So the next classification of drugs used to treat congestive heart failure are diuretics. You want to keep that person on the dry side. They shouldn't be drinking whatever they want, that's for sure. The other thing is this. You have a bad left ventricle. And think about it for a minute. If you're washing your car, you turn on the hose, that hose has a certain pressure to it. And then you look underneath your wheel well, and you see a bunch of dirt. Here's the diameter of the hose. You want to get the dirt out from underneath your wheel well? So what do? You take that hose and you put your thumb over it. What you have done is you have decreased the diameter. You have made the hole smaller, but the same amount of water has got to come out of that hose, whether the hole is big or small, and because it got covered up by your thumb. So when the hole is big, the resistance is going to be low. And when the resistance low, that causes a drop in pressure because you got to maintain the flow. However, on the hose, if you put the thumb over it, you decrease the diameter. And when you make the diameter of the hose smaller, the resistance to that water flowing goes up. And when the resistance goes up because you made the hole smaller, the pressure has to go up in order to get that same amount of water out of that hose. That's exactly how the cardiovascular system works. Exactly. So a real simple question. Real simple. If you have a left ventricle that is jacked up, you had a heart attack, and now that left ventricle is weaker, it has to get the blood through those arteries down to the cells of your body. So the question I have for you, do you want the left ventricle that's weakened to have to pump that blood through arteries that are this big, A, or arteries that are this big, 2? The answer is you want to dilate those arteries. All the arteries in the body, you want to dilate them so that the left ventricle in its weakened state doesn't have to generate as much pressure to get that blood down to the cells of the body. And that's exactly what happens in people with congestive heart failure. So the other class of medications that's used to treat the dilated congestive heart failure are vasodilators. What they do is they give them ACE inhibitors. Basically, ACE inhibitors do two things. Number one, they are massive arterial vasodilators. They take arteries throughout your body that were like this and make them go like this. So if the arteries throughout your body get bigger, that means resistance to arterial blood flow goes down, and that means that the little left ventricle doesn't have to generate as much pressure. And that's a good thing when the left ventricle is damaged. The other thing that it does is that it inhibits the effects of aldosterone. And simply put, aldosterone is a hormone that causes the kidneys to retain sodium. If you reabsorb sodium from what is soon to be urine back into the blood, water is going to follow by osmosis, and that's going to increase your blood volume. And anytime you increase your blood volume, that's going to increase venous return to the right side of the heart. The right side of the heart's fine. It can stretch, no problem. It ain't damaged. So now you're going to send more blood to the lungs, and now all of that extra blood that came back to the right side and got pumped to the lungs, now it's going to end up in the left side. And the left side of the heart is already maximally stretched out. So now you are going to overstretch this guy even more. So watch. You have more blood inside the left ventricle, and the left ventricle has a hard time handling the blood that it was getting before. Now what do? You go and you add more blood back to it. This is the critical piece. So watch. The venous return of blood to the heart, right side of the heart then contracts, sends that blood to the lungs. If you look, the pulmonary vessels get smaller, so they terminate at the pulmonary capillary and the alveoli. Gas exchange occurs, and all of that blood comes back to the left side through the pulmonary veins. Here we go. This is huge. The left side of the heart is failing because you had a heart attack. The remaining parts of that heart, again, they have to stretch and they have to dilate. So the heart in people with congestive heart failure at rest is already stretched. It's contracting as hard as it can. It can't contract anymore. So if you add more blood back to the heart, the left side of the heart, because you got up and you started walking around or you laid down, then all of that blood that's in the left ventricle, that extra blood is going to come back and it's going to overstretch it. And when you overstretch the ventricle, you overstretch it. That reduces how hard it contracts. It reduces the force of contraction of the heart. the result is wherever that blood came from, it is going to back up into. So in the case of the left ventricle, where did it get its blood from? It got it from the left atrium. And the left atrium got it from the pulmonary veins. And the pulmonary veins got it from the pulmonary capillaries. And as a result, that blood is going to back up into the pulmonary circulation. So if you look, you have an alveoli that's one cell membrane thick, and you have a pulmonary capillary that's one cell membrane thick. And as that blood from the left ventricle is backing up, the pressure in the capillary, called capillary fluid pressure, is going to increase. And it is going to force water out of the capillary and into the alveoli. And that fluid will build up in the alveoli, and you get pulmonary edema. And if you listen to somebody's lungs, you will hear that fluid, little Rice Krispie stuff. And because most people are sitting upright in the lungs, that fluid, because the heart's failing, builds up in the bases. And then as the congestive heart failure worsens, it starts getting higher and higher into the lungs until you get the death rattle. And then that person's going to die. So the question I have for you, do you want a lot of extra venous blood coming back to a person's heart if their heart jacked up? The answer is no. And that's why I told you, there's no pressure in the venous system. So by gravity, all of that venous blood is going to be sequestered in the legs. But if you lay that person down, by gravity, all of that venous blood is going to come back to the right side of the heart. Again, the right side of the heart works fine. So you send more blood to the lungs. But the left side is jacked up. So now more blood's going to come back to the left side because you laid the person down, and they will go into failure quicker. That's why, as the person's condition worsens, they have to sit more and more upright. They have to store all that extra venous blood in their legs, otherwise they can't breathe. And that, ladies and gentlemen, is congestive heart failure.